Hello and welcome to Nationwide. We're reaching you live on the network service of the NTA. I'm Hawa Salihu Adama. We start today with the latest on COVID-19 in Nigeria. Report from the Nigeria Center for Disease Control (NCDC) indicates that as at midnight 20th May 2020, a total of 284 new cases of COVID-19 were confirmed in the country. The breakdown of the figures shows that Lagos has 199 new cases, Rivers 26, Oyo 19, while the FCT and Borno have 8 each. Others are Plateau 7, Jigawa 6, Kano 5, Abia 2, with Ekiti, Delta, Kwara and Taraba recording 1 case each respectively. With this development, Nigeria now has a total of 6,677 cases of COVID-19, out of which 1,840 were discharged, while 200 patients have been lost to the virus. Better synergy amongst government at all levels and health partners has been advocated as the antidote for a more robust national response to the coronavirus pandemic. Cross River State Governor Professor Ben Ayade said this while speaking alongside other guests on COVID-19 situation reports in States on NTA's program Good Morning Nigeria. Olusheye Adeagbo completes the report.
As at 21st of May, information on the NCDC web page indicates that 35 states in Nigeria, including the FCT, have COVID-19 cases except Cross River and Kogi State. Cross River State Governor Professor Ben Ayade explained that technical and strategic actions helped maintain the state's current COVID-19 status. The government says governments at national and sub-national levels, as well as health authorities, should engage in more practical strategies to help in winning the war against the pandemic in Nigeria.
Why are we flying in reverse transcriptase into Nigeria? Why are we not producing it? I mean, just imagine if this border closure continues for long, you will run out of drugs because even our drug manufacturing companies in Nigeria import the active ingredients.
Speaking from Enugu State, Commissioner for Information said there are challenges on the closure of the borders, but the state has embarked on strategic monitoring with focus on stopping community transmission.
Right now, council chairmen in border areas are living at the border. Not just withstanding that, His Excellency has also been relating and engaging very closely with his border governors in Benue, in Ebonyi, in Anambra.
Representatives from Ekiti State and the LCT also explained their response to the fight against COVID-19.
We are working seriously on advocacy and sensitization because we felt people still need to know so much about this disease and believe in it so that they take personal responsibility of their situation.
The guests were unanimous in their suggestion that citizens must adhere to all safety measures to protect themselves from the virus. In Abuja, Olusheye Adeagbo, NTA News.
And a 160-bed isolation center equipped with state-of-the-art facilities has been inaugurated in Osogbo to assist the Osun state government in containing the spread of coronavirus. The Coalition Against COVID-19, CACOVID, provided the facility. Femi Afariogu completes the report.
With effort still ongoing to discover the vaccine and cure for coronavirus, the private sector-led coalition against COVID-19 in Nigeria, CACOVID, is helping to bridge the gap in the health sector in the state. Osun State is the latest to enjoy the gesture with the renovation of a health center well equipped with 100 beds and consumables, while state government provided additional 60 at Mercyland Isolation Center in Osogbo.
We believe that there should be a proper handshake between public sector and private sector, what they call PPP, public-private partnership. So we believe that if it is okay for the public sector, of course, there will be a conducive atmosphere for private sector to also thrive.
Osun now has 8 isolation centers with a total of 342 beds and is still striving to reduce the active cases from 6 to 0.
Our administration had swiftly adopted creative and proactive methods to manage the coronavirus pandemic since its birth in Nigeria. We have dedicated funds, human resources, and indeed focused resolve to beat this virus.
CACOVID promised to distribute palliative soon to states in furtherance of its fight against COVID-19. In Osogbo, Femi Afariogun, NTA News.
And to talk more on the CACOVID isolation donation to Osun State, we have joining us on telephone the Osun State Commissioner for Information, Mrs. Funke Adenike Egbemode. It is good to have you, madam.
Good afternoon. Thanks for having me.
Okay. How well is Osun State faring in the fight against COVID-19?
Thank you very much. You will remember that we were one of the very first few states to lock down the states, even when we had just one case. So right from the time the first case was recorded in Nigeria, we had been preparing for it, and we have not slowed down. We've not had any new case in a week, but we keep sensitizing our people. We keep equipping our isolation centers. We keep training our health workers and everybody who is part of the responding team. So it's an ongoing activity for us. We are not relenting or slowing down because we are not getting cases every day. So we are doing all we can.
While you say you are on the right track, what would you consider the greatest impediment to the state fight against this pandemic?
I would say the borders that people continue to breach. That's what I would say is the only challenge that we are facing. Of course, we would like more funding from well-meaning Nigerians from the federal government so we can continue to boost our response activities and our isolation centers to continue to get better. But largely, we have had very cooperative citizenry, and the governor and our health workers have been quite cooperative and supportive of this fight against the pandemic.
Okay, you earlier told me that what we have now is a partial lockdown, but you're back to total lockdown again at the weekend. Do you intend to relax the weekend total lockdown due to Ramadan festivities, especially for the Eid prayers?
We will have I'm part of the task force. We're having a meeting after this program, and we will discuss it again. We will review it with the team from NCDC and the federal task force, those who are working with us. We will ask questions from the responders, the people manning our emergency numbers, to see whether there is reason for us to relax. Otherwise, the governor is determined to keep the state safe, is determined that we do not have community infections. So whatever the specialists, whatever the doctors, the health workers tell us is what will inform what we are going to do. We will not take any emotional or sentimental step.
Okay, you said no community transmission so far, but you have about 6 active cases. Here, the isolation center is increasing, now 3 in number. Are you preparing for a spike, or it's just mere anticipation?
We do not want to be caught unawares, just like we started our campaign and sensitization programs long before we had our first case. We just don't want to be caught napping. We want to be sure that we have intensive care units functional in case any of the cases move from mild to severe, mild to moderate to severe case situation. That's why we just keep working on everything on all sides. Even our campaign, our sensitization programs have not reduced. So that's what we're doing.
Okay, Mrs. Funke Adenike Egbemo, the Commissioner for Information, Osun State. We truly appreciate your joining Nationwide today. Thank you very much.
Thank you for having me.
Moving on, concerted efforts are currently on to unravel the mystery behind the COVID-19 in Kogi State. Great thinkers and scientists are looking at the peculiarities of the confluent state as it joins the rest of the country to seek solutions to the threats of the coronavirus pandemic. Let's now join Francis Udojo for more.
The background music tells the story here in Kogi as life remains almost as normal. Elsewhere, fear and anxiety is created by COVID-19. This is not replicated here in the state. Arguably, more than 75% of the working population in Kogi State depend largely on daily income, and a lockdown of their businesses could also create an unmanageable scenario.
So had it been they had the coronavirus here, then we lock down. Because how can we go keep it for Kogi State?
We know what is happening in the whole world, but God made the case of Kogi State a different thing.
He say lockdown, they will go take manage.
With this in mind, the state government's interface with intellectuals and experts in genetics and animal breeding, neuroanatomy and cell biology is aimed at reaching a meeting point of how best to manage the crisis of a pandemic in a state like Kogi.
If you are a researcher, My Excellency, and you know the results that you are going to get before you enter into a research, then whatever you have used to do that research is no more the research material. You that is doing the research now becomes the research material, and the materials you are using now becomes the researcher, and that is why they will not have any answer to COVID-19.
Okay, if you cannot produce food that we will eat, we will all die of hunger.
The presumption is that Kogi is on the right track, having taken proactive steps and observing medical guidelines of safe hygienic practices and other directives which account for the current zero COVID-19 case in the state.
If it is the COVID-19 as they want to paint it, they can't step into Kogi State here.
The lecture series draws attention to the need for the Nigerian authorities and medical professionals to subject claims by international bodies, organizations, and foundations on COVID-19 to thorough verification. From Lokoja, Francis Udojo, NTA News.
We take some messages now. More COVID-19 related stories when we return. Do stay.
I wish to once again commend the frontline workers across the country who, on a daily basis, risk everything to ensure we win this fight. For those who got infected in the line of duty, rest assured that government will do all it takes to support you and your families during this exceedingly difficult period. I will also take this opportunity to assure you all that your safety, well-being, and welfare remains paramount to our government. I am using this opportunity to express our deepest condolences to the families of all Nigerians that have lost their loved ones as a result of the COVID-19 pandemic. This is our collective loss, and we share your grief.
We have observed the lockdown. We have practiced the measures in order to curb the spread of the virus, but we can do better. The coronavirus spread is increasing daily, and only together can we cut down the numbers and defeat the spread of the virus. Remember, COVID-19 is not a death sentence, and a recovered patient cannot spread the disease. Do not stigmatize. Do not hesitate to report any case, or if you have come in contact with anybody that has been infected with COVID-19. If you have cough and fever, please stay at home and call your state hotline. Find state numbers at www.covid19.ncdc.gov.ng. Remember, it is for your own good and for the good of every Nigerian. Let us do better and defeat the virus. Together, we can do this. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
This is a very important message. Operation wear your mask, especially for people who don't old. No forget, your body no tranga like before. It not even tranga like your children or your grandchildren. So therefore, always wear your mask for this pandemic period. No they to receive visitors, so even if not your grandchildren. Make extra mask where you go fit wash, make like 2 and dash your neighbor 1. And if they come out for house, wear your mask always. And if you come back, wash your hand with soap and running water to avoid coronavirus. Make you for live long for your children and your grandchildren. No forget, Operation wear your mask, especially for people who don't old. Protect me, I protect you. The NOA bring on this message.
There is a lot of fake news and report circulating, especially on social media, on the coronavirus. Do not believe or partake in the spread of these fake reports. If it is not on the official website or news from the Nigerian Center for Disease Control, NCDC, disregard such report. Only together can we beat this virus. Only together can we overcome this pandemic. Follow the instructions and guidelines provided to combat this virus. Most importantly, stay at home. Self-isolate, regardless of your status. The virus doesn't move unless we move. Let us work together to better Nigeria. Together, we can do this. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
It's nationwide. We now take you straight to our Lagos Network Center for more reports with Dotun. Dotun, it's your turn.
Thank you, Awa. The concept of regular hand washing with soap under running water is the first among the list of measures people must imbibe to prevent COVID-19. With the easing of the lockdown, the Nigerian government mandated businesses, public offices and spaces to ensure that hand washing points are present in all facilities.
Practical measures you can take.
To avoid COVID-19 comes need for regular hand washing as a precautionary move against getting infected. In Nigeria, like the world over, hand washing has become a necessary ritual. But while some have taken action in many government and corporate organizations by strategically putting hand washing units in their environments, the same can't be said of public places which are a melting pot for buyers and sellers.
Tell everybody that they should wash their hands, clean up their places, and they normally do it.
Public transportation is another area of concern and covers commuting on land and water.
They called us at Ikeja. They educated us, the stakeholders.
And at every entrance, they have to wash on basin to wash their hands.
Meanwhile, police stations and other essential public offices like hospitals and shopping malls have all ensured compliance.
Like the supermarket, even from our own house, before you go in, there is water there for you to wash your hand and soap.
And if you are going to every police formations now, so not only will your the temperature will be taken, the washing of hands, and even the sanitizer, every police formations.
However, there is the renewed call for government to provide potable water, especially in rural areas, to enable dwellers comply with the new normal. The Nigerian Customs Service, Western Marine Command, has seized cannabis sativa worth more than 1.2 billion naira along the western waters in Shasha area of Lagos. The seizure, regarded as the largest in the history of Nigeria Customs Service in terms of size, weighs more than 12,000 kilograms, compressed in 16,000 wraps.
The jumbo bags are filled with cannabis, and DPV, that is the duty paid value, is over 1.2 billion. So we have been trailing it for close to 2 weeks. When they left their base in Ghana through the sea, until then asked my officers to be on the sea. So they were on the sea for 3 days. But on sighting them at a very far distance, they jumped into the sea. So we're on them. We're not sleeping at all. 24 hours surveillance on the high sea.
The Comptroller, Western Marine Command of the Nigeria Customs Service, Olugbega Peters. More details on that seizure will come in subsequent bulletins. A suspect is in custody of the Nigeria police in Lagos for carrying out a fake funeral for herself. Annie Daniels has details.
The suspect is a 19-year-old girl who came to Lagos in search of greener pastures. According to her, her reason for faking her own death is to break free from family pressure.
My mom do call me, but she'll say my younger brother is sick. But I'll tell her I'm not working for anybody. I'm only working to go back to school and become great. And when I become great, they can ask me for whatever. I won't refuse.
The suspect confessed to having informed few of her friends about her plans, but she never envisaged it would turn out to be a criminal offense.
Someone told my uncle that Sylvester is my boyfriend, so he decided to chat up with Sylvester. So them and Sylvester were now working together. So when Sylvester told them too that I was truly dead, so Sylvester decided to show them my corpse, the one I sent to him as my own corpse. So he decided to show them. After showing them, and they were like, So then I went to open another new Facebook account, which will make them not to know that I was the one.
Lagos State Police Public Relations Officer Bala Elkanah confirms the report.
We got a petition from a family that they saw on social media that their daughter died and she is secretly buried by her friends. And the friends posted that the girl said they should not inform her family that she is dead. So that became a concern for them, and they approached the police to investigate.
Bala Elkanah says the law must take its course. In Lagos, Annie Daniels, NTA News.
And that's it from here. It's back to Awa in Abuja.
Very well, Dotun. And here in Abuja, the Minister of Foreign Affairs, Jeffrey Onyema, has confirmed that 292 Nigerians have been successfully repatriated from the Kingdom of Saudi Arabia. In a Twitter message, the minister said the stranded Nigerians have been brought back courtesy of the Saudi authorities. Most of the returnees are nursing mothers and children. The federal government, the minister said, is committed to evacuating stranded Nigerians whose visas might have expired amid the coronavirus pandemic that has put on hold air travels. And I understand the PTF on COVID-19 is now ready for the daily briefing.
Nigerians watching us from home and their offices, gentlemen of the press, a very good afternoon to you. I welcome you to the national briefing for Thursday, 21st May 2020. Today we are privileged to have with us the members of the legislative arm of government, and welcome you warmly. This afternoon, we'll be taking the remarks, as usual, from the chairman of the Presidential Task Force on COVID-19, as well as the technical updates from the Honorable Minister of Health, the DG NCDC, and the National Coordinator. If we have updates from any of the ministers, any of the sectors covered by the ministers, we shall bring them to the podium to give you the updates before we take your questions. We now begin with the remarks by the chairman of the Presidential Task Force, the Secretary to Government of the Federation. Chairman, sir.
The Chairman, House of Representatives Ad Hoc Committee on COVID-19, Honorable Dr. Haruna Michelia, the Deputy Chairman, Right Honorable Sam Onyegbo, members of the Presidential Task Force, distinguished ladies and gentlemen, gentlemen of the press. I welcome you to the national briefing by the Presidential Task Force on COVID-19 for Thursday, 21st of May, 2020. As we progress in the first week of the extension of phase 1 of the eased lockdown measures as directed by Mr. President, it is necessary to remind Nigerians of the objectives of this course of action, which is primarily to save lives. It is also of utmost importance to remind our subnational entities on the need to diligently implement the guidelines and to exercise caution in relaxing restrictions in a manner that is capable of setting back the gains already made. Above all, it is imperative for each of us to take personal and collective responsibility. The foregoing admonition becomes critical as we prepare for celebrations at the end of the holy month of Ramadan. It is the prayer of the Presidential Task Force that we shall all celebrate this Salah and many more in good health, and beseech the Almighty to accept our supplication and look upon our nation and the world with mercy. I therefore use this opportunity to wish all our Muslim brothers and sisters a very happy and safe Eid celebrations. But as we celebrate, we want to once again caution on the need to wear a mask, keep physical distancing, avoid large congregations, avoid unnecessary interstate travels, and observe personal hygiene, amongst other suggested safety measures. The Presidential Task Force is pleased to inform you that in order to underscore the seriousness attached to this COVID-19 pandemic, the House of Representatives has set up an ad hoc committee on COVID-19. In deepening the existing collaborative spirit, we shall work together with the legislature to be more productive and add value to the overall delivery of services to Nigerians, on behalf of whom we hold our responsibility in trust. I welcome you, sirs, for joining us in spite of your very tight schedules. These are very difficult and odd times, and we will need your legislative support and cooperation even in the execution of our mandate. In the same spirit of collaboration and coordination, I wish to inform you that I participated in the virtual meeting of the National Economic Council with the Vice President and all the state governors today. This is coming on the heels of an earlier virtual meeting between the President and the governors in a space of 1 week. During the meeting, the issue of alignment of their state-level actions with the guidelines issued was emphasized. Similarly, emphasize is the need for the states to diligently implement and enforce compliance. Particularly, I underscored the need for governors to provide personal and strong leadership at this time, carry the policy of community ownership to the grassroots, and create deeper awareness. The governors were also advised on the decision taken by some of their colleagues to permit large gatherings as such decisions could inadvertently endanger the elderly, the sick, and those with underlying factors during such gatherings. The strong advisory from the PTF is that large gatherings beyond 20 persons remains restricted and should be adhered to. On Monday, 18th May 2020, when we briefed the nation on the next steps of our national response as approved by Mr. President, I mentioned that the guidelines for this phase would be explained in details and published. I'm pleased to inform you that the document is now ready, and the national coordinator will present the document and subsequently upload it on the different platforms. This would further clarify any ambiguity hitherto perceived and no doubt clearly let us know where each and every one of us stands in playing our roles to make the guidelines work. For some time now, the Presidential Task Force has consistently answered questions and provided explanations on the category of persons and services exempted from some aspects of these guidelines, particularly as it relates to restrictions on interstate movement and curfew. For the avoidance of doubt, essential workers include our indefatigable medical personnel, diligent journalists, courageous fire services personnel, and telecommunication workers are all exempted. The Inspector General of Police has further clarified the categories of essential workers in alignment with the guidelines and has issued instructions to security agents to work on the approved exemptions. With this clarification, we sincerely hope that the persistent complaints of harassment by these categories of essential workers, especially medical personnel and journalists, will be put to rest so that we can harmoniously work in battling this pandemic. And I would be upfront to offer apologies to all of you that have suffered some form of treatments that are not expected to have been meted out to you in the course of the execution of your several duties across the nation. The Presidential Task Force urges all essential workers to go about their legitimate businesses, carrying with them valid means of identification, and to exercise courtesy in approaching security personnel. Through the surveillance system set up by the Presidential Task Force, we have received reports that Nigerians have been purchasing the hydroxychloroquine in large quantities. We wish to reiterate that this drug has not been certified for use in treating COVID-19 in Nigeria by the relevant health and pharmaceutical authorities. And that underscores the reason why initially we were very cautious of identifying any form of medication, because we know that the issue of abuse in terms of self-medication will become quite rampant. We therefore strongly warn against please seek medical advice And if you are confirmed positive, kindly self-isolate in an approved facility. The COVID-19 is highly infectious and dangerous. So don't attempt by any stretch of imagination to think that you can prepare yourself for management and also treat yourself. The Presidential Task Force continues to receive reports and support, donation of equipment, and solidarity messages from professional organizations. In this regard, we want to acknowledge the Nigerian Institute of Quantity Surveyors, Chemical Society of Nigeria, the NMPC and its partners, Mrs. Osia SA, through its Nigerian representative, Maestro, and offer of services pro bono. Yesterday, Wednesday, May 20, 2020, served as a stark reminder to the entire world about when the World Health Organization reminded the world that we are still far away in the fight against this pandemic. According to Dr. Tedros, the WHO Director General, 106,000 cases were recorded globally in 24 hours, representing the highest single-day number since the outbreak, because it brings to on humanity. If after the several the world of the pandemic, in terms of number, 106,000 globally yesterday, with the efforts that have been put in place, with the containment, with the testing, with the expenditure, we still recorded that number. That is truly an evidence of the fact that COVID-19 has come to ravage our wealth and our health. And it is going to disrupt the way and pattern of life. I don't know for how long, but I can assure you that our ways of life will remain disrupted for a very, very long time. For us in Nigeria, the importance of this message is very clear. We need to eschew skepticism about the existence of this virus and its potency, change our behavior, and commit to joining hands in tackling this pandemic. Yesterday, we recorded, as per fatalities, 202 losses of life across our nation. To a lot of people, that is just statistics. But for some of us that are sitting across here, it's not statistics. We can place some faces, and those of you that are sitting on the other side, you can place some faces on these numbers. And that drives home the fact that we are in very difficult times. We are being confronted with an enemy that is unseen. We are being confronted with something that is overwhelming the entire world, and we cannot but do everything to reduce its impact, slow down its ravaging force, and make sure that we flatten the curve and do everything possible to stop the transmission in our communities and exposing those vulnerable that can fall extremely sick and in the process lose their lives. I will make it a little bit personal for me. I've lost a colleague in this process. Of the 5 working days, the week preceding Mala Abba being positive, the former the late chief of staff to the president. Of the 5 working days, we sat beside each other in 4 of those days, with the exception of the Tuesday that he went to Kogi for condolence over the loss of the mother of the governor. I shared official functions with him. We sat beside each other for the 4 of the 5 working days. Some of my colleagues had meetings with him on Saturday and Sunday, within the same week. But unfortunately, he lost the battle against COVID-19. I can see the face of a chief judge of a state who was my classmate in Abuja when we went as young lads to study law in 1976. That's almost 40-something years ago. I can see those faces. I can see the ravage that has come upon our land. And I know you can identify with a lot of people out there. So my message to you today is that we have a collective responsibility to work together in earnest, realizing that each and every one of us has a part to play in this enterprise so that we can force this virus and limit its spread. I am particular about congregational gatherings. Large gatherings would expose even the 20% that we've been trying to protect. So I would urge our subnationals to really reconsider their decisions in allowing for large gatherings to take place until when we have been fully prepared and we can adjudge that the moment has come for that to be allowed. I now call on the Honorable Minister of Health and the DG, Nigerian Center for Disease Control, to update you on the current situation, while the National Coordinator will intimate you with the critical elements of the guidelines. I thank you for listening.
Good afternoon, everybody. The Secretary to the Government of the Federation, Honorable Ministers, Permanent Secretaries, Directors, visiting member of the National Assembly. I greet you all, and as we mark these holidays coming and prepare for a holiday, we must not forget that we are in the middle of a massive global pandemic which has taken many lives and where the virus will not be taking a holiday. We must therefore not let down our guard, must continue to be as vigilant as possible. Look at the figures of other countries, we shudder and shake. We have been lucky to have been spared such bad figures so far, but must not take anything for granted. As far as our country is concerned, our surveillance and contact tracing and testing capacity is increasing gradually in all states as more laboratories come aboard. I would like to use the opportunity here to call on all our state governors and leaders and FCT to increase the number of surveillance teams and isolation and treatment capacity to keep pace. I was also a member of the, to able to take part today at the National Economic Council and have an interaction with their excellencies, in which I had the opportunity to speak also on the COVID-19 pandemic. We have developed more key performance indicators to track surveillance and strategic directions and programs. As of this morning, we have recorded 6,677 confirmed cases in 34 states and the Federal Capital Territory, out of which 1,840 have been successfully treated and discharged. Sadly, we have recorded about 200 deaths in 25 states and the Federal Capital Territory. A finding from the analysis of the death patterns shows 70% to 30% for male and female, around that ratio. And about 70% of fatalities were persons over 60 years old, while majority of positives were between the ages of 29 and 49. Those are the most active ages in life. I also advise those who are taking the test and are waiting result to heed the advisory to self-isolate yourselves in your homes until you get your result, and in order to be able to save your friends and your family, wear masks and observe hand and respiratory hygiene until your result is out, so that your community and those around you will not necessarily be exposed. We are scaling up training of health workers on infection prevention and control, and so infection among healthcare workers is gradually reducing. In Kano, the training has been scaled even to patent and proprietary medicine vendors, and retraining is now a continuous process to be sustained so that nobody will forget the protocols for this very highly infectious disease. State-level infection prevention and control measures and training are being carried out working with partners and has also been standardized to be stepped down to community level. The fact-finding team of the Ministry of Health that went to Calabar has returned successfully with a report, and we have been able to identify areas of strength and areas that are in need of upgrade, including laboratory infrastructure. The state of readiness of the state against COVID-19 is reasonable and includes setting up of COVID-19 task force, production of PPEs, face masks, of which samples were presented to our team and will be forwarded to NAFDAC for validation. The areas of strength and weaknesses, as said, are still being analyzed so as to improve federal cross-river state collaboration and support. The critical findings is that no case of COVID-19 has still been reported as at 20th May 2020 when the team returned to Abuja. 16 cases had been tested, of which all were negative, and 28 persons of interest had been followed up, of which none of them presented any symptoms after completion of their 14 days of self-quarantine. And the testing center, there are no other testing centers established in the state as yet. We are going to be working with the state to establish protocols and improve communication and reporting to our reporting centers here in Abuja. Our team in Kano has made a very successful trip now to Gombe on fact-finding mission. After the tour to Borno, the reports from these states are being awaited so that we can streamline the response and provide more targeted support. A new medical team has been assembled to take over the management of the This Day Dome Isolation Center, which was donated to the government by the private sector. And it is a very comprehensive treatment center for second, third, and even fourth level treatment. It has dialysis machines, ventilators, and facilities for waste disposal. Admissions will start at any time now. We have heard of the threatened industrial action in Lagos State among doctors. I spoke with the president of the Lagos chapter of the association yesterday evening to dissuade the doctors from the planned sit-at-home protest that they wanted to conduct. And I also listened to their complaints about harassment at security checkpoints. I communicated this to the Honorable Honorable Commissioner of Lagos State, Commissioner of Health, with the suggestion that he facilitates the issuing of special passes that identify health workers as such to ease their transit to and from work, and also to ease the screening for security officers at checkpoints to be able to identify who is who. It is my recommendation that the same passes be issued to health workers in all states and the Federal Capital Territory to forestall misidentification. I also had the honor of carrying out a similar intervention in respect of medical workers at Federal Capital Territory in the company of Federal Capital Territory Minister under the auspices of the Speaker of the House to reach an understanding over stabilizing the sources of payment of their salary. Our health workers are our foot soldiers, and we shall ensure that they're able to discharge their duties unhindered. In response to a question that was raised the other day about the morbidity pattern, I will say that the comorbidity of the persons, the fatalities we have had to COVID-19, 70% of them had hypertension or diabetes, and then the rest were kidney disease, HIV, cancer, tuberculosis, and others undetermined. I shall remind Nigerians again on the need to adhere to the advisories which I re-emphasize, that masks must be worn and washed daily, and washed, especially when you go out, you must wear your mask, and where possible you iron it, and that the mask should cover mouth and nose and should not be left under the chin while you are having a conversation, as you often see on television, particularly when you are having close quarter conversations. Tissues, as usual, must be used during coughing and sneezing and appropriately disposed of. All other measures that have been prescribed, like social distancing, abstaining from any kind of unnecessary travel, should be adhered to. Any kind of travel from one state to the other carries the risk of transporting a virus, the coronavirus, from a place of prevalence to a place where it was not present. We trust that the collaboration and cooperation of citizens is understood as an important and extremely important part of the success of whatever it is that we're all doing here. Thank you for your attention.
Chair of the Presidential Task Force, honorable ministers, guests, honorable members of the House of Representatives, ladies and gentlemen of the press. Today I'd like to address an issue that has led to quite a bit of conversation and consternation in some places. Visuals of people in treatment centers in relative comfort, and the anxiety that has led to and discussions comparing those images to the images that we also see on TV of very severe cases in different parts of the world. And imagery we don't want to see in Nigeria. But if we have to, we will deal with it. But it's always important to remind people on the full spectrum of clinical presentation that we see with this new virus. We see a disease, a new disease, that in 80% of cases, people are mildly or completely asymptomatic, i.e. they don't have any symptoms at all. Under normal circumstances, there wouldn't be any reason for these people to be in hospitals and to be isolated. The only reason we're isolating them is to prevent them from transmitting to others. Now, in many contexts in the world, when this outbreak first broke out in China, they carried out a very similar policy. They treated all the severe cases in hospitals and isolated every single person that was infected in isolation centers, the temporary isolation centers, some of which you saw being built in 10 days and 2 weeks. You remember those images on TV. In other countries in the world, and this is public knowledge, in Germany, in the West, in Western Europe, in the US, they've made a decision to treat all asymptomatic and mildly symptomatic people at home. That's a decision that they have made in that context. We have struggled with these decisions in Nigeria because we're struggling with the realities of where we live and the context that we live in. We want to prevent transmission, therefore we want to institutionalize the treatment of everyone. We've held back on advocating for home treatment and home isolation because we recognize that the circumstances in which many Nigerians live make home isolation a very difficult and sometimes an impossible option for many people who live in very tight accommodation in family groups and communities. So there are no easy options. Every day we identify new patients. Yesterday we confirmed 199 newly infected people in Lagos State alone. It means that if we were to continue on our policy of institutional isolation and treatment for everyone, Lagos this morning has to find 199 new rooms to accommodate these newly diagnosed people. This is not possible in our reality. It is a simple fact. You can look at the numbers. As the numbers increase, we will struggle with this. So the Presidential Task Force and everyone involved in this response is having to think about alternatives. We're thinking about community management. We're thinking about home isolation. We haven't come out with any definite policy on this, but we are thinking about these things because we have to. It's not a choice. It's not an ideal scenario, but these are the realities of managing cases in our context, and we're looking at all the choices available to us, and we will have to make those decisions. We will make the best decisions available to us in the best interest of everyone, together with state governments, together with local governments, together with the private sector, to provide the best possible care for our people. Having said that, this is a new virus, and we're learning. Every day we're learning about transmissibility of the virus. Up till now, we have kept patients in care or advised that patients be kept in care until they turn out to be negative on the test that we're using, the PCR test. New evidence is emerging that even when the test is still positive, that in certain circumstances after that patient has been in care for a certain amount of time, it is possible and safe to discharge that patient to home isolation. So we're looking at the evidence, and we might change our guidelines over time. And I'm sharing this so that we start preparing ourselves for some changes in direction of how we are planning to go. But also to say that we are learning. There are no definites in this response. And the key thing is that we are ready to look at emerging science and change as we learn more about this new virus. We must never forget that we're in May. This is the month 5 since this new virus emerged. There's no other disease, as far as I remember, that we have learned so much so quickly as we have evolved our response. And with every new bit of knowledge we learn, we tweak the response a little bit in order to make it better. The biggest Achilles heel of this virus is that you can transmit it while you feel completely well. This is the biggest challenge we have, that you can transmit this virus while feeling completely well. And the people you transmit it to can be vulnerable. They can be those that will then get it and become extremely ill and sometimes pass away. So there's a responsibility that you have, not only to yourself, but to the most vulnerable in our society. And that is why it's so tricky to make these decisions, because you're not just deciding for yourself, do I isolate myself or not? This decision is important for you, but also your family and your loved ones. So as we go into this weekend, it's important that we think about these issues, and hopefully they will drive us into taking responsibility for those things that we can take responsibility for. I was happy yesterday to receive a new set of guidelines, draft guidelines, by the Public Transport Owners of Nigeria Association, PTONA. Those are people that manage the long-distance buses that travel across the country, what we call luxurious buses. They had drafted their own guidelines for reopening safely, and they sent it to us for review and to advise them on whether the measure that they are now recommending for how to manage their loading centers, their buses, their engagement with their customers at the point when we may allow them to reopen. And this is really what we've been advising every society, every organization, every community, be it faith-based, be it cultural-based, be it professionally based, to come up with guidelines for themselves. We're happy to advise, we're happy to engage, but this needs to be led and owned by the leaders of those organizations. We need every bit of society to take responsibility for that part where they own and manage. It's only by working through this that we'll be able to come out of this safely. But like the chair of the Presidential Task Force so eloquently said a few minutes ago, society will not be the same in the near future, and we have to really learn to adapt to it. And the earlier we do this, the better we can live safely into the future, at least for the short term. So thank you very much. Have a good evening.
Honorable visitors, the Chair and Deputy Chair of the House Committee on COVID infection, the Chairman of the Presidential Task Force, members of the PTF, ladies and gentlemen of the press, good evening. I would like to start, first of all, by going through the key highlights of the implementation guidelines for the containment of COVID-19. Before I do that, I would like to emphasize that we have not changed a lot of things. What we had 2 weeks ago will continue. So effective from Monday, the 18th of May, the easing of the lockdown remains largely the same and will be characterized by the following enforceable actions, which will include the mandatory use of non-medical face masks, the mandatory provision of hand-washing facilities and sanitizers in all public spaces, the restrictions in interstate travel and intrastate travel as well, based on certain conditions which I will outline in a few minutes, and the adaptation of offices and businesses to ensure physical distancing, including the use of floor markings, crowd control, and mass gathering reduction strategies. The mass gathering of more than 20 people outside of a workplace is still prohibited. We will ensure controlled access to markets and locations of economic activities. Mandatory temperature checks will continue in public spaces with physical distancing of 2 meters. All passenger flights will remain banned, and there will be mandatory supervised isolation of persons arriving from outside the country for at least 14 days. In terms of the regulation of these guidelines. We will continue to work with local authorities and encourage them to create mobile courts for immediate prosecution of offenders, particularly those who violate guidelines relating to face mask covering, relating to monitoring of temperature, or institutions that fail to comply with these protocols, as well as restrictions on interstate movement. In terms of the detail, just wanted to remind the general public that for Lagos, Ogun, and FCT, the curfews that have been imposed overnight, and including the nationwide application of this, will continue from 8 p.m. to 6 a.m. The lockdown in Kano has been extended, as we said at the beginning of the week, for another 2 weeks. In terms of general movement, people may go out to buy necessary foods and for exercise. Movement between local government areas is strongly discouraged unless for critical reasons such as healthcare and work. The public are advised to avoid unnecessary contact with people. Interstate travel is restricted except for essential travel, such as those involved with the supply chain and services, such as goods, agricultural products with a limited capacity of accompanying personnel, petroleum products, relief items and supplies, construction supplies, and registered courier services. Within state borders, the restrictions relating to reduced occupancy for buses, taxis, and tricycles will be maintained. Travel should be between the hours of 6 a.m. and 6 p.m. For buses and motor parks, the same opening hours apply between 6 a.m. and 6 p.m. For agriculture, trucks bearing agricultural and animal products must be allowed easy passage, and companies involved in food processing can also continue with their operations. For construction sites, we are asking for state governments to please take up responsibility for the provision of waivers to allow the construction of critical roads to resume, but this should be limited to the hours of 6 a.m. and 6 p.m. For banks and other financial institutions as well as offices, now is the opportunity to start adjusting to the new life post-COVID as we lift restrictions over the next 2 weeks. We're therefore asking banks and offices to make allowance for physical distancing measures both inside and outside their premises, to ensure that staff working in the offices are limited to no more than 50% capacity, and to encourage online banking as well as working from home. Offices are allowed to open for the same hours of 8 a.m. to 2 p.m., including banks. Shift work is encouraged for manufacturing and pharmaceutical industries, but pharmacy shops will continue to remain open overnight as required. The hours of 8 a.m. and 2 p.m. opening hours will remain relevant not only for offices and banks, but also for supermarkets. And we are also reducing the number of hours that restaurants can open to the same 8 a.m. to p.m. time limit. Clubs, bars, beer parlors, and gardens, etc. will remain closed, including recreational parks and communal sport areas. All schools are also to remain closed till further evaluation. State government and security agencies are enjoined to ensure effective and strict enforcement of these guidelines. I'll now briefly talk about Salah, because we're all going into Salah, and to say that COVID infection has not gone away. It is still very much with us. We really need to respect the guidelines, particularly those related to self-distancing rules and avoidance of mass gatherings. We should make sure that we use face masks as part of our Salah attire for this year. And I would like to call out, particularly for those that are vulnerable to these infections, especially the elderly above the age of 65. If you are diabetic, if you have an underlying health problem, you have a personal responsibility for looking after your health. Do not put yourself at risk this Salah. COVID will go away eventually. The pandemic will go away. But we would like to be part of those that see it go away. There will be other Salahs. There will be other Salahs, but only if we are alive. If we are not, then really it becomes an issue. So as we celebrate Salah, let us not allow COVID to celebrate Salah with us. Let us commit to stay alive. Let us commit to protect ourselves and protect our loved ones from this infection. Thank you.
Thank you very much. We'll take just one update from the Minister of Foreign Affairs.
Honourable Chairman, honourable members of the House, good evening, everybody. I just wanted to give a brief update because we're coming to the end of the 14-day quarantine period for the first and second batch of evacuees. You'll recall that the first batch came in from Dubai. The second batch came in from London and came to Abuja. The first batch was in Lagos. And then we had the third batch that came in from New Jersey, from the US. We actually had a fourth batch that came in 2 days ago from Saudi Arabia. Nigerians who had gone for Umrah and who were caught there. There was some miscommunication as we were not ready at the time to receive anybody actually. But I must say, and I really congratulate our team, consultants who did a fantastic job with such late notice to gear up and receive 292 people, accommodate them and look after them, and they've settled down very well. So they did a fantastic job, our team did there. So as they've come to the end of the 14 days, I spoke to the Inspector General of Police today, and he was also very helpful because some of them will have to travel across state lines, and that was being a source of concern for them. But the IG of Police has directed the commissioners of police in the two cities in which they are located, that is Abuja and Lagos, to receive them individually and give them personalized passes and a phone number that they can reach if they have any problems at any of the borders going home. So we're hopeful that they will not have any issues as they go back. Of course, there are Nigerians still all over the world crying to come home, and we're doing everything we can. It's just not possible. We have those in India, in China, in South Africa, in Sudan, and others who still want to come from the US, others who still want to come from the UK, from France, Turkey, all over, and it's just a huge challenge. So I urge them to continue to bear with us, be patient, because the reality is that we can only process a certain number at any given time. All the different facilities that are required to be in place, human resources as well, are limited. And so, it's just a process, and it pains us to know and to see that there are Nigerians out there who are really desperate and going through very difficult times and needing and wanting to come home. So we're going to continue to do everything possible to bring them back as quickly as possible. And with the promise of more resources that we have received, hopefully that will enable us to be able now to quicken the process, because obviously hotels will refuse to take people until they see the money and that kind of thing. So hopefully we'll have a little bit more room for maneuver to enable us to bring more people in. But of course there's the constraints of human resources, because as you can see, as you have heard, the numbers are going up all the time of cases. So those in the country already that need to be isolated and so forth are also a big strain on our medical system, without even adding those who are coming home. So, so far, so good, but there's still a lot more to be done, and a lot of our people out there still struggling and still suffering. But just to assure you and them that we will continue to fight for them and try to get them home as quickly as possible. Thank you.
Thank you, Honorable Minister of Foreign Affairs. We will now move to this segment for questions. Are we ready? Yes. Okay.
To attend to this objective, the Abuja Declaration was And now with the COVID-19, how do you look at possibilities of attaining to this 15%? And as a body, WHO, what kind of engagement are you having with the African head of government to persuade them to see the reason of increasing budgetary allocation to health sectors? And secondly, not quite long, the US government has threatened to withdraw fundings for WHO, simply because of, as they say, the way the WHO is managing the COVID-19 fight. How are you managing this fight that makes United States government to feel not satisfactorily about it? Thank you.
Good afternoon, all. Rachel Abuja from the News Agency of Nigeria. My first question is for the Minister of Health. Sir, how can you assure Nigerians that the war on COVID-19 will not negatively affect the war against other diseases like TB, HIV, and viral hepatitis? Against other, then what measures are in place to fight these diseases simultaneously so that we will not lose the previous gains from those diseases? My next question is for the DG NCDC. So I would like to know how many gene experts we've converted in total, and I would also like to know the criteria for distributing this gene expert across Nigeria. This morning you made mention of, you gave criteria for discharge patient, COVID patient, that is just going to be a single test instead of 3. I would like to know why. Many thanks.
Mr. Chairman, members of the PTF, my colleagues, good afternoon. My name is Nancy Oyedia Orum from AIT. I want to start with Mr. DG, sir. Sir, some time ago, the Ministry of Health sent a delegation to Kano State to ascertain the cause of mysterious death in that state. And I'm aware that the local COVID-19 team in that state briefed the media and said most of the deaths in that state were COVID-19 related. So I want to know, why are those figures not captured in the national data of COVID-19 deaths in Nigeria? Mr. SGF, sir, last week, I remember in one of your speeches, you said about 9 local government areas are the most affected. They have recorded the largest chunk of COVID-19 in Nigeria. So I want to know some of those states. And is it also possible that we can have curfew and lockdown in those specific areas, just as is attainable in other climes? Finally, sir, to the Foreign Affairs Minister, I know you've spoken so much about evacuating people from India, but I got a message from someone who is yet to be evacuated from India. He said he was privy to get information from the proprietors of isolation centers in Lagos and Abuja, and they were made to understand that before they will be isolated in their facilities, CBN and NNPC must pay 100% of all the monies. So the guy is asking, now that you've met the pledge, the CBN and NNPC have met the pledge, when exactly is evacuation going to start from India, looking at the fact that these people are ready to foot the bills? Thank you.
Good evening, ladies and gentlemen. My name is Kayla Megwa from Channels Television. And just to get a clarification from the Minister of Foreign Affairs, the returnees from Saudi Arabia, are they in quarantine at this moment? Just to get that clarification from you. And my next question goes to the Minister of Health. Now, there's a 6-month import duty and VAT waivers that were approved for medical equipment and supplies early in May to combat the economic implications of COVID-19. And at the time, the Senate was asking that the gesture be extended to other drugs for hypertension, diabetes, anti-malaria drugs. Will this be done? And if it's being worked on right now, I just need clarification on that. Second question I have, the minister had also earlier told us that the evacuees, so he had complained that some of the evacuees that came back to the country were not complying with isolation center rules. You had stated that they were receiving visitors, etc. And you said you were going to tighten security around those isolation centers. Just to get clarification on if that has been done and if those evacuees are obeying the isolation rules right now. And then our final question is for the NCDC Director General. This question has to do with the elderly, people who live with the elderly at this moment. How should family members be living with the elderly at this time? Should the elderly isolate themselves? Can they still mix up with members of the family? And what particular workout regime should they be on at this moment? That's the question for the DG NCDC. Thank you very much.
Good evening, the SGF, honorable ministers, my colleagues. My name is Rahila Lassa. I report for Voice of Nigeria. My question is for the, I don't know, either the NCDC boards or environment. All right. I want to know what happens to the home or the house of a person who tests positive for COVID-19 after he has been taken to the isolation center. Is fumigation done, or is there a way that the house is disinfected? I'm asking this because the national coordinator has talked about stigmatization a lot, so I want to know so that people will have confidence to associate with the person after recovery. Thank you.
Good evening, sirs, SGF, honorable ministers, honorable lawmakers, and my colleagues. My name is Femi Akonde. I'm a reporter with TVC News. My question is to the task force, and maybe the SGF should take it. So we know, like you always say, the impact of this COVID-19 on the country's health and wealth. And a lot of businesses have been hit by this. But in Abuja, business owners are complaining. There's now a lot of them have been approached by the Environmental Service Department of the Abuja Municipal Council to fumigate their premises, their business premises, and it is mandatory. This particular invoice from the Abuja Municipal Area Council is even charging the owner of a supermarket as high as 2 million naira. And they say, kindly make payment not later than 1 week of receipt of this letter. Is it okay, sir? That's my question. And my next question is to the DG NCDC, sir. We know that as we ramp up testing, a lot of contact tracing is also done, sir. So in doing this contact tracing, you advise people who have come in contact with confirmed cases to self-isolate. But how do you monitor these people to ensure that truly they self-isolate? Because some people say that once the NCDC leaves their doorsteps, these people go about their normal lives, and maybe this could be one of the reasons why we begin to have community infection around the country. And to the Minister of Foreign Affairs, sir, you've already you talked about the people who would be ending their 14-day mandatory isolation very soon. You know, a lot of them are saying that maybe road travel might not be their thing, that could there be an arrangement for, let's say, a flight to take them out of Abuja? Thank you.
Mr. Chairman of the Task Force, members of the Chair of the Task Force, my name is Emmanuel Kutara from Radio Nigeria. My first question goes to the Minister of Foreign Affairs. According to some reports, some Nigerians who arrived Cotonou from different European countries yesterday were being subjected to COVID-19 tests at 150 euros each after seizing their passports. They are right now in a hotel at their own expense. The question is, who takes responsibility for these Nigerians, or are they responsible for themselves? Because the embassy in Cotonou said they were not aware of their coming. For the chairman of the ad hoc committee on COVID infections, I would like to know your specific role in that committee. Also, the Minister of Health, you gave us an update on Cross Rivers. We want to know the update for Kogi State. Thank you.
The chairman, members of the task force, my colleagues. My name is Amaka Ude. I report for Rice News. And my question goes to the Minister of Health. So I want to know the kind of mental and nutritional care being given to people in the isolation centers. I ask this question because I've had an opportunity to interact with some people who have recovered from different states, and some of them had major complaints on the kind of mental care they were given. Some said no one even had any sort of talk with them to help them recover. So I would like to get your reaction to that. And also, earlier you spoke about a training being done for healthcare workers, and people living with disability, they want to know if this training also involves, this frontline workers learning to really take care of those with disabilities. And my final question goes to the national coordinator. So I got a message from some Nigerians who, unfortunately, they were stuck in a state different from where they reside prior to the lockdown order. So they're asking, they said they've been stuck where they traveled to for too long. They're asking the PTF if there's a way that the PTF can give them some sort of, freedom to go back to their place of residence, maybe a day or two sometime soon. Thank you.
Mr. Chairman and members, my name is Kenneth Nanim. I work for NTA. It has been established globally that technology must be deployed in the fight against COVID-19. Then my question is, what is the government doing as regards to installation of human decontamination facilities in public places like schools, hospitals, or markets, as part of preparation plans towards the full reopening of the economy, so that people who walk into an establishment or office or market, will have themselves decontaminated. Then we have it at both entry and exit points. We want to know if government is thinking in that direction, and if government is thinking in that direction, is government making use of indigenous technology to drive this? Thank you.
Good evening, members of the PTF. My name is Juliana Taiwo Balonye of the Sun newspapers. My first question goes to the Minister of Education. Sir, your ministry has been accused by the visually impaired people of abandoning their community. They are asking for learning aids, most especially to ensure that they are carried along in the online schooling going on currently. So they want to know how soon you will attend to their request, sir. The DG, NCDC has answered my question on luxury bus, but the luxury bus owners, but they want the coordinator to give them timeline for planned resumption, just like it's been done with aviation, that is resuming early June. The SGF, sir, there are concerns about flaws and lack of transparency by government agency in the procurement of PPEs and other health equipment in fighting COVID-19. The new BPE procurement guidelines has expunged the provisions that requires CSOs and professional groups to be observers in bid opening rounds. Does this worry you? Post-COVID, in terms of corruption, does it worry you? And what would be your, what will you do to address that, to address the concerns of Nigerians that they might witness corruption post-COVID? Sorry, thank you.
Good afternoon, sir, SGF, honorable ministers, and my colleagues. So I have two things I want to say here, and I want to appeal to the Minister of Information and Culture to please answer in Yoruba and also in English, because I'm going to ask in Yoruba and also in English. Thank you very much, sir. Sir, I want to suggest, sir, because we went throughout, let me say, like 13 states in this country, and we found out that the transporters, they are not doing according to what we have said here. And most of them, if you ask them questions, they will tell you that is what the government said we should be doing. They carry 3 people at the back of their cars. Some will not put on face masks. Some have even increased their transport fare. And that transport fare now is not even affecting the market. The food items we are buying before has increased with almost 150%. And all the excuses is always on COVID-19. So what are we supposed to do about it? I'm suggesting maybe we can call these unions to order. Maybe they can speak the language they will understand. Maybe they couldn't understand our language. Maybe their union can speak to them and they will understand better than we. And also, we can also, the Ramadan festival is coming very close and very near by this weekend. I would be surprised that you see many elderly people that will tell you that they need to go and pray. They need to go and celebrate. So I think the Ministry of Information have a work to do in this area to sensitize them the importance of staying at home. Then my second question is about education. Sorry, my 2 sons at home, they're asking me, Mommy, when are we going back to school? And they told me yesterday that they saw it in one of the dailies that said in 2 weeks' time. They want to confirm. I don't have any answer to give them. So the only thing I told them is that by the time I get here today, I will ask the question to confirm. Are they resuming in 2 weeks' time? Yes or no? Then in Yoruba, sir, ìbéèrè tí kọ́kọ́ sọ ó dàbí ìbéèrè ó dẹ̀ tún máa bá òní wípé púpọ̀ lọ́rọ̀ ọ̀rọ̀ tá à ń sọ ń bì báyìí àwọn awakọ̀ wa wọn ò gbọ́ dáadáa ó dàbí pé kò yé wọn tó tàbí kó jẹ́ pé wọ́n fẹ́ máa ṣe ìfẹ́ inú ara wọn a rí i pé púpọ̀ nínú wọn ò ní gbé èèyàn méjì sẹ́yìn èèyàn 3 èèyàn 4 ló ń gbé l'Abuja débi wípé owó orí ọkọ̀ gan ó ti wá pé lésì tó di pé ó ti wá ń kó bá ọjà tí à ń rà tó jẹ́ pé à ń jẹ débi wípé ọ̀pọ̀lọpọ̀ ló jẹ́ pé kò lè ra oúnjẹ gan tó nǹkan tó máa jẹ nínú ilé mọ́ mo wá dábàá wípé ilé-iṣẹ́ àṣà àti ìròyìn lórílẹ̀‐èdè Nàìjíríà yìí tẹ́ ẹ̀ ń jẹ́ mínísítà ẹ̀ bóyá ẹ lè ní nǹkan kan tẹ́ ẹ lè bá wa ṣe sí i débi wípé èdè tó máa yé wọn wọ́n á lè bá wọn sọ àti pé àwọn ẹgbẹ́ wọn àjọ wọn tó ń rí sí ayédáadé wọn bóyá èdè táwọn yẹn máa sọ ó máa túbọ̀ yé wọn ju èdè táwa ń sọ níbí báyìí lọ. Èkejì tí mo wá sọ nípa ti ètò ẹ̀kọ́ a rí pé àwọn ọmọ wa kan tó wà nílé wọ́n wò pé ìgbà wo làwọn fẹ́ padà lọ sílé ìwé wọ́n ní lórí ìwé ìròyìn kan lánàá wọ́n rí wípé ní ọ̀sẹ̀ méjì sákòókò tá a wà yìí wọ́n máa padà sílé ìwé wọ́n á ń béèrè pé ṣé bẹ́ẹ̀ ni àbí bẹ́ẹ̀ kọ́. Thank you very much, sir.
Thank you. We have taken the questions. We'll be taking responses from the Honorable Minister of Health, the DG NCDC, the National Coordinator, the WHO representative, the Minister of Foreign Affairs, the Honorable Minister of State Education, Honorable Minister, Information and Culture. Then we will invite the Chairman of the House Committee, Ad Hoc Committee on COVID-19 to the podium to